Hi, good morning, everyone. Good evening and good afternoon for other places. Today is 1st of January. It's a happy new year. We are entering 2022 and a lot of countries are still celebrating the New Year Eve. So we do not expect many people here today. We have still a lot of countries coming up to give an update. We are on this 91st CMAAO session. It's an international weekly meeting. We started this year on the note to bring all the medical associations together to become a roundtable think tank and to update about what's going on and to come with the consensus statements of what is we are going to do in our countries. A platform which was started by Dr. K.K. Agarwal, whom we lost in 2021, and the journey continues for the education. Today, we are celebrating the new year on the hope that 2022 will give us some relaxation on the COVID, but with the note that we need to still continue with the COVID appropriate behavior. We need to still maintain our social distancing. We should still keep our hygiene levels stronger, and we should still continue with the masking. It does not matter whether the Omicron is mild or not. It is important for us to continue and save this world. With this note, I will open the platform for a COVID update from our representatives who are here. And we will start with Dr. Ravi Naidu.
Thank you very much. Thank you very much, Saurabh. First, let me wish all of you here a very happy new year. We hope 2022 will be a much better year than what we have had in the last 2 years. Everybody, I think, has a positive outlook for 2022. As we were speaking earlier on, in Malaysia now, the cases are around 3,000 to 4,000 daily. The deaths have come down to about 30 to 40. Then, of course, the admissions in hospital are reducing. Number of Omicron cases are not that many, but many of them actually are from those who are foreigners who have come into this country. And so far, we are not seeing any outbreak like in India or even in UK. However, the government has placed some mandatory laws like, wearing of face mask, social distancing. They don't allow big functions in the outside, where thousands, like for example, New Year's Eve last night, normally there would have been big gatherings with fireworks display and all that was not allowed. Smaller functions within your own, within your club or your association or even within your home is allowed, but you have to follow the SOP. Like last night, for example, we had a New Year Eve dinner and countdown in my club where we had to apply to the government for approval. They wanted the measurement of the place. They wanted to know how many to a table, what time, everything they wanted, And so we only restricted 6 people to a table, those big tables, which normally can accommodate 10 people. We were only allowed to accommodate 6 people per table. Of course, the only time you're supposed to remove your mask is while you are eating, but otherwise you're supposed to wear your mask all the time. But saying that as human beings we try sometimes when you're wearing a mask, it's so difficult to talk to somebody and all. You find on and off people taking off their mask and talking and all that. But procedures are being followed in Malaysia very strictly because it's by law, it's mandatory. If you're caught, you will be charged and you have to pay a heavy penalty for that thing that you're caught for. So saying that Malaysia is trying its level best, and of course now we are on the 3rd dose. Many of the people have already been given the 3rd dose. I have taken my 3rd dose or my booster dose. and the government is encouraging everybody to take their booster dose. So far things seem to be quite okay in Malaysia. Thank you, and a happy new year to all of you.
Thank you. And just to add what Ravi said, I just want to share the graphs. So here is the situation which looks like in Malaysia. I just want to share the numbers since we have a little more time today. And the situation is pretty controlled, as what he said. And this is the statistics for the cases. This is the visualization of the cases. This is the vaccine dose. And these are the vaccinations percentage. These are the hospitalizations. So everything looks pretty okay. Okay, so.
But Saurabh, I have a question to Dr. Ravi.
Yes, please go ahead.
This is actually still this is hovering around 3,000 to 4,000. What is the reason behind? Because there is a strict this protocol is followed there strictly. So why it's not coming down? So, Dr. Ravi.
Dr. Ravi, this is a question for you.
Yes. Why is it not coming down?
Yeah.
Well, I suspect that what is happening is the cases that are reported are those who are, of course, all are vaccinated. In fact, most of them are 2 doses. In fact, 90% in Malaysia of the adult population have got 2 doses. And then we have a huge migrant population here. And they are also working in the plantation, the industrial sector. Now, it is happening among everybody, including Malaysians, as well as the foreigners. But I say that what is happening is, even though despite the vaccination, the COVID is still spreading. Only thing, the seriousness is not there, and most of them who get their COVID are asked to be quarantined at home for 10 days, unless they have major symptoms. Otherwise, they're asked to stay at home.
But what about the things actually you are telling that most of the people are vaccinated
Yes.
and in terms of genome sequencing, what is the percentage of the Omicron and the Delta?
Oh, I'm sorry, I don't have that percentage, Jamal. I'm sorry, I don't have.
Okay. Can we have an update from you, Dr. Jamal Chaudhary from Bangladesh?
Thank you so much. Actually, in Bangladesh, we are just passing. You can say it's a good time. You can say because it was near about 1.2% to 2% was hovering around that. But this 3-4 days, we are seeing it's about 500 per day infections, and this percentage of infection, this positive cases are just about 2%. And we are genome sequencing here is done. You can say is a very little number. I must say, if you compare with the number of infections, so it's not too high. Omicron, we are having only 3 to 4 cases I so far heard, but I'm not sure that if you do it as randomly, how far it will go. So regarding vaccinations, we have already completed 30% have just given the double doses, and 40% has given single dose. And we have started the booster also. I have also taken. So that is we have taken the booster as a Pfizer because AstraZeneca and the Sinopharm Sinovac was there in the initial stage. So we are taking the Pfizer as booster, Pfizer or Moderna like this. And our government is also just expressing their idea that you may have the AstraZeneca also, you may have the other vaccines also. Yes, in a just simple way, you can say whenever it's available, whatever it is available, you just give it because it may enhance the immunity, personal immunity level. Yesterday, I asked our vice chancellor of the Bangladesh Medical University, which is the biggest medical university here and the oldest. So they were conducting a trial actually, and then they said that 8% of their the subjects were not showing enough immunity after 2 doses. They are telling that it may be immunocompromised people or the old people are showing those things. Actually. So it's a mandatory that they have to go for the booster, no doubt in it. And the other things that everything is open here. People are not following the protocols, actually, most of the people. And because of Omicron, I told before the meeting that yes, because of the Omicron's message, that it's not that people will not go for severe condition or critical condition or even death. So they are not bothering it. But I think from even from CMAAO, even we can just ask and we can just collect this you can say statistics that whether this Omicron is causing the moderate cases also. We are talking about the mild cases, but what of the moderate cases? We are not talking about it because it will have been print on the lung. So whether it will go for long COVID or post COVID, what will be the condition? That has to be also ascertained actually, and then the people should be cautioned about it. Thank you so much.
Dr. Jamal, what is the reason that the Bangladesh still not have vaccination? I just saw that it's only 26 to 27% for the fully vaccinated and 52 for the first vaccination.
Yeah, it's rising. The government is telling that from the next month we will give more and more vaccines. Yes, this month, January. Yes, it will rise up, and I think by February we may cover up to 70-80%. Like.
Okay, thank you. Can we have Dr. Benito from Philippine Medical Association? Dr. Benito, are you there? Yeah.
Yes. I'm just opening my cell phone. Good morning. Happy New Year to all. Sorry, I wasn't able to join you for the several months because we have our national vaccination day last November 16, 17, and 18 of last year, and had the second national vaccination day last December 16, 17, and 18. However, we had the Typhoon Odette last 17, 18, and 19, and it has landfall 9 times in different provinces, affecting 9 provinces in the Philippines. That's why we have a hard time now of having the relief goods, and the Siargao Island was devastated, 95% devastated, and we still no electricity, water like that, even in Cebu and other areas in the country. And as of before Christmas, we have the lowest COVID cases of less than 300, almost 250. However, due to Christmas and the influx of different OFW, the workers from abroad and the relatives from abroad, there was an increased cases. There was reported 4 cases of Omicron. Those came before Christmas, and there are 3 Omicron cases discovered locally. Yes, before New Year, we have the case of 300, then it was doubled to 600, then 800 in December 29. Then in December 30, we have 1,700, and yesterday we have almost 2,900, almost 3,000, and we expect that will double today because of the mobility of our people here, and we are the hard time because of the Christmas season and the New Year celebration last night, and the people are not practicing social distancing, and different markets, malls were full of people, even children, and the government placed again the NCR, the National Capital Region, the largest region in the country, the central area, to a level from level 2 to level 3. Level 2, we have 70% to 80% indoor. Now we'll have the 30% and 50% outdoor activities. Then no no casinos, no ferias like that, and we do hope that it will not go to the surge of a port surge, because we had a two surge last year, and we do hope that you can help us in the rehabilitation of our 9 provinces due to the typhoon Odette, that most of our people became homeless, even the doctors. It's the during the first vaccination days, we almost vaccinated an average of 2.7 million a day, and we ranked fourth in the vaccination in a single day. The first is China, then then third is US, then the Philippines got fourth place in the single day vaccination. All.
Thank you, Dr. Benito from Philippines. Can we have Dr. Matunda Pille from India to give an update?
Thank you. Let me wish all of you a very happy, prosperous, healthy New Year. And coming to the statistics, as far as India is concerned, we are afraid that we are going on to a third wave situation. The number of cases, both Omicron and Delta, has jumped from almost 800 per day to 24,000 at the national level. 22 states have Omicron infection. It has been proved. The total number comes to about 1,400. These are now confined mainly to big cities like Delhi, Bangalore, Mumbai, and like that. The numbers are slowly becoming more. And this is mainly from people coming to India, particularly from very high risk countries. But then local spread also has started. At least 5 or 6 cases, it has been proved that it is from local transmission, not from international arrivals. So regarding vaccination, single dose, almost 90% of eligible people have already got it, and a double dose, 65% of the population has received. And now India has relaxed or increased the age group. Now from 15 to 18 age group population also are going to be vaccinated from today onwards. And that the vaccine that has been chosen is Covaxin, the indigenously made vaccine, Covaxin. So that is what is going to be given to the younger population. And the third dose, also a decision has been taken by the government that above 60 years and those with comorbidities will be given the third dose or precautionary dose. That is what the terminology India is using. And here again, as of now, the same vaccine which you had taken as the first dose and second dose will have to be taken. Whether any other vaccine can be taken, mixing and matching, a decision is yet to be taken by the government. So that is where we stand as far as vaccine is concerned. Regarding the drugs, among the 2 oral drugs that is available, one drug has been approved for emergency use in our country, but the mainstay of management still continues to be monoclonal antibody, which is now being given as a outpatient treatment or a daycare sort of thing. For one day, the patient is in the hospital, it is given and they are allowed to go home. And so far as Omicron is concerned, the spread definitely is very high. But then the admissions, hospital admission is only 1% of the cases, and ICU admission is hardly 0.1%. So that is where we stand, just like the international scenario, where the transmissibility continues to be high, but the severity is still low. Only one death has been reported from among 1,400 cases of Omicron. So that is where we stand. But then, although the hospital admission will be less, but the outpatient management and home isolation, the strain and stress on OP management and home isolation is going to be high. So it is an inevitable fact that this will spread all over. But then all that the government can do is to control the transmission by COVID appropriate behavior by the population. And now we have, we can give 2 lakh, we can do 2 lakhs of RT-PCR tests in our country per day. So that much of thing is available, but 3 or 4 fast testing agents have been identified. So you can even do it at home or on your own. So that facility, as far as the rapid test is concerned, that facility is available now in India. Now the government dictum is that anybody who has fever, sore throat, headache, body pain, malaise, diarrhea, loss of smell or taste, the usual COVID symptomatology. If you have, you directly go to the centers for testing, and if the facility for self-testing is available, you subject yourself to that. And so that is the instruction that has been given. So that is a scenario in India. The spread definitely is not very high. So regulated, controlled spread of infection will reduce the strain on the health sector in our country. And we are prepared for the worst. Thank you.
Dr. Pillai, just a question to you. You were just mentioning that most of the Omicron cases are just incoming people, incoming passengers. So what is the protocol actually followed in the airport, in your airports? And number one.
Everybody who want to come to India, that is true with any other country. Before enlightening the flight, you have to do COVID test, and RT-PCR has to be negative if you have to take the travel. On arrival again, the RT-PCR is done for those people who are coming from high-risk countries as of now. But we have seen that those who have been negative when enlightening the flight, when we test it here, or when you test it after a week or so, they are positive. So that disparity is there. So how far this protocol is going to detect such cases early and reduce transmission is a big question mark.
Actually, number two is you are telling that your people are allowed to test in the home. And what about the notifications? What about the notifications? If they may not even when they become positive, they may not even if you do not have the may not even inform the authority, even if they are not compelled to do that. What is the system?
Notification. Those who are doing the self-test, they are mandatorily they should notify that they have done the test and whether it is positive or not. But if you look at the ground level scenario, if a person in a family is positive, even if others are positive, none of them come for testing because they assume that they have the disease and take the precautions. So the number of cases definitely is not really a ground level true picture. It could be 4 or 5 times or even more than that. That is true with any other country. Because once one person is positive, the rest of the family members normally are not going to do the test, but take precautions.
I think in India, there's a statement which has come from the government saying that if anybody who has a fever or some kind of a symptoms are considered as a COVID suspect, so they have been asked to keep all the COVID appropriate behavior, quarantine themselves, and do not, go out or, just wear the mask and everything. So that is pretty simple. The government has said, in the statement, consider any person with a fever as a COVID suspect. In the last 24 hours, we have seen a 36% increase. But again, the cases were only 309. But yes, it is rapidly increasing. So thank you, Dr. Pillay, for giving a very, very nice update.
Saurabh,
Thank you.
actually, just one actually should be clarified that there is a compulsory or mandatorily notification from the individual who is doing test in the home. So, what is the system actually followed? Because when he is taking the this test from somewhere and taking to the home, and whether it is registered there, and you have to inform whether you are positive or negative, is there system is there or not. That is the thing. But if
It is
you don't,
mandatory. You are supposed to, if you are doing on your own at home, you
yeah.
are mandatorily, you should register and inform.
So
Of
Okay.
Dr.
course,
Chaudhary,
this
there's
has
another
been
thing.
just introduced, and maybe over a period of time, some more refinement and some more SOPs as to how it has to be done may come in.
Okay, good.
Also, there's another thing. Don't forget that Omicron cases are coming, a lot of them are coming in asymptomatic people.
Yeah.
So that happens when you're traveling or when you're going out of the city and you have been randomly picked up. And then you figure out whom you have connected in the last 24 hours. And then, those things happen. So those things have been there. And if you have been COVID tested, you've been reported in the authorities, and everybody gets information so that you are just pretty safe. That's all. But again, it is, it is how we are trying to control. And I think it's pretty good till now. So should we move on? Can we have an update from South Africa? Much needed update from Dr. Akhtar Hussain.
Good morning, everyone. Compliment for the season. Happy New Year's. South Africa, we have last 24 hours, 11,754 cases, and total death in last 24 hours was 84. So now the number 91,745 till the COVID started, that number is going high, 91,000 plus death. We have active cases, 193,000, sorry. We have still got active cases, 193,000, and our recovery rate is 91.8%. Our hospital admission, last 24 hours, 9,401 people were admitted in the hospital around the country. Out of that, 730 went to the ICU and 309 cases were ventilated. Last week, from 19 December to 25th December, positivity rate was 35.3%. Hospital stay is around 2 to 3 days. And our vaccination again is slow. We are going through fourth wave, but Christmas and New Year's, all the restrictions were not follow up. Beaches were full. Parties was all around. So we going to see any spike maybe next week. And the new protocol, what I was talking last week, is again revised. Now at least we are going to have some, before last week, the new protocol said no quarantine, vaccinated or unvaccinated, only severe symptomatic for 10 days. But the new protocol now with the CDC, there will be a isolation for the symptomatic patient and minimum 5 days with the mild symptom and the severe one 10 days. And the children are still getting infected in South Africa. Healthcare workers are getting booster dose. And I think this month they are going to allow for the senior citizens, then age-wise will go down. And New Year Eve, President announced to lift the curfew. So he's going through the lifting all the bans and things. and alcohol can be sold in an open environment. They can have those parties up to 1,000 people, and closed door is 500. Thank you, Sharab.
Dr. Akhtar,
Just to give a graphical thing, what Dr. Akhtar has said is this. It's a snapshot of what happened on 31st December for South Africa. Yeah, go ahead with your question.
Dr. Akhtar, I
Yes,
have
Dr.
a
Gamal.
lot of things to know from you actually. You have not mentioned about that because I came to know from South Africa that they are telling that Johnson & Johnson is effective against Omicron. And this is a very useful information because, you know, the Pfizer and other vaccines are already told that it's evaded by the Omicron too high. So whatever the statement or this trial result, can you just enlighten us about this?
Those who got a Johnson & Johnson, they are going to get the booster dose, and they are not really protecting Omicron, but it is protecting the severe disease or hospitalization. And Johnson & Johnson and the Pfizer, both these two vaccines, only two vaccines in South Africa utilized. So it is protecting severe disease. So the milder disease, breakthrough disease is not protected. But there are some immunity through the T cell and other collaterally they improved. So we didn't have real statement that Johnson & Johnson is not working or working. Or the work is going on. The research, we haven't got those Medical Research Council, all the facts came out.
But by the time actually you have got a lot of cases of Omicron came to know, and could you just enlighten us about the moderate number of or the percentage of moderate cases which is having
Okay.
the pneumonia from Omicron?
Omicron, the 80 to 90% cases who diagnosed, they were very mild. The symptoms were mainly the body pain and sore throat and severe sore throat and headache. Very few cases had a fever, but they had a secondary infection. The severe one is mostly those who are immunocompromised and those who have a comorbidity, especially with diabetic hypertension, and those who are on a chronic medication and uncontrolled chronic disease. Those are the cases, had a severe cases. So severe cases, you can see last 2 weeks, which admitted in ICU high care, not more than 300, 400. And the duration of his stay of there is 2.5 days, you can say. So to give how many severe cases, according to the hospital data, I can say it's a less than a 1%, not even 0.5%.
Then we can say the moderate cases is 8 to 9%.
Come again, I can hear.
Moderate cases, number of moderate cases. Moderate means just having the lung pneumonia.
Yeah.
That's pneumonia imprinted the lung due to Omicron.
Yeah.
I'm just talking about not the Delta. I'm talking about the Omicron.
No. Omicron, we didn't see many pneumonia with the Omicron moderate cases. That also is less than 1%, maybe 0.7, 0.8%, because this time we are not seeing severe pneumonia, very, very few.
Dr. Akhtar, can I ask one question? What about the reinfection with Omicron? Reinfection with Omicron.
Thank you, Doc. We have seen two things we have seen here. Those who are vaccinated, they have got through breakthrough infection, first wave, second wave, third wave, and fourth wave, some of the cases, not many. And
Okay.
those who got Omicron last month or last few weeks, we haven't got any report that they got reinfected within few months. So we don't have any data that the same person got the Omicron within few weeks.
Thank you. Thank you.
Thank you.
Thank you. So shall we move on? We have Marie from Japan now. Marie, can we have an update for what's going on in Japan?
Thank you very much. We are starting the sixth wave now. The main of them are Omicron. So, but we have only 300 around per day for tested positive for coronaviruses. So we don't have any serious patients or experience increase of the in-hospitalized patient. Thank you.
I think this is the kind of update we want from every country. So,
Pakistan is not doing.
so pretty quick and short. Thank you, Dr. Marie. Can we have an update from Pakistan?
Dr. Qazi.
Okay.
Okay. First of all, very good morning and very happy New Year, and hope everybody will have a healthy New Year 2022. Okay, we have quite a controlled situation in Pakistan. We had about 556 new cases in the last 24 hours, only 6 deaths. The vaccination is quite good. More than 70 million got double doses, and the 96 million got their first dose. And we have a program of getting booster doses for 50 plus, and it's going on well. Life is pretty normal. Everything seems open, but the advocacy from our national health authorities is there to follow the SOPs and follow the protocols. That is there, and advices are there for the community to get their booster doses. Those who got their first 2 doses, because we had first 2 doses were Chinese vaccine. Now the booster dose is Pfizer, and it's being provided free of charge, and the booster dose is going on very well. So situation pretty under control in Pakistan. Thank you.
Charles, you want to add something?
Furthermore, Dr. Qazi, we have, yes, Professor Bukhari, we have seen few cases of Omicron in Islamabad and Karachi, but still no admission of any person with Omicron in the serious disease in the hospitalized. So the same situation as was discussing our friends in other countries, the peoples are presenting with mild flu-like conditions. So as a scientist, I will say that this Omicron is replacing its previous all variants, and it will exist like a flu. And I think there is no worry. There will be no worry. And with the new happy year, hopefully we will be free from this pandemic. Thank you so much.
Okay, Saurabh, can I
Yes,
say
Dr.
something? Okay, thank you very much. I must appreciate your efforts in the last year. You did very well to continue the CMAAO meeting and continue the mission which is being done by K.K. Agarwal. So we must appreciate you. And I hope that this year will continue with this all our participation of the National Association. In Pakistan, it's Dr. Qazi Wasid and Dr. Mulazim already informed everything. But I just add a few things because now from a couple of days, it seems that the number of cases in Pakistan, it was of days before, it is now 1.6 or something. It's going on. So the reason is that here in Pakistan, the people are not following any SOPs or anything. We as a activist, we are very much concerned about the future because the number of cases can be increased and the government will go another lockdown or something, any anything, anything to control the spread of corona virus. So we are worried, and as an activist of Pakistan Medical Association, we are very much vocal, and we advise the people, please follow the SOPs so that this virus is eliminated from the country. And I hope that this year is will be much better as compared to the last one, 2020, with the proper vaccination, complete vaccination. And I think when the people all over the world have vaccinated at least 80% or 75%, then it will be less chance of creating the new variants. So we hope for the future, and we have to work uh, for the elimination of this pandemic in this year. Thank you very much, Saurabh.
Thank you, Dr. Sajad. And I think I never expected that I will be able to continue this between so renowned doctors. So I think it's him who is letting this continue, and he's there with us still. Thank you so much, everyone, for joining in. Now,
we have here also, I think from Hong Kong, yeah.
I'm sorry?
Hong Kong.
Yeah, I'm just,
He's there.
YS.
Yes.
Hello, good morning.
Oh, you're hiding somewhere today. Okay.
Yeah, so Happy New Year.
Happy New
Year, because after all, we are all busy in the celebration activities here. Although we have been really troubled by the new wave, impending new wave, because we had 2 local community cases of Omicron, and spread by the air crew members of our airline, and who had flouted the rules of quarantine and left his home to join meetings with other people and celebration with other people, and spread the Omicron virus to the community. So, of course, most of the people in Hong Kong became very, very disappointed and, in fact, quite angry, because we had been free of any local community cases for almost 3 months already. And then now, the so-called zero tolerance policy would then be challenged, because given the transmissibility of Omicron, I expect really, I mean, hopefully not, but then I'm afraid the 5th wave will be coming in Hong Kong now, and that will disturb and will disrupt any hope of opening the border or opening the communication between mainland China and Hong Kong. So that would be a big blow to the economy in Hong Kong again. And the restriction rules have been demoralizing many people already for such a long time. And but of course, well, given that I mean, even many countries who had adopted the so-called existing with the virus together, like Korea or Singapore, somehow they have to really tighten the restriction rules again on and off after they had opened up the border. So I think it's quite difficult for Hong Kong to adopt similar policies like Korea or Singapore, because we are to be, we really hope that we could reopen the border between mainland China and Hong Kong. Then we have to also abide with the policy with the mainland China's. That is to have the zero tolerance rule. Well, of course, I think that we could not be complacent just because we already have 72% of our population with the first jab, and then 69% with the second jab. And the third booster dose and the third dose are now being given to those who had already had the first two doses 6 months ago. But our specialists, infectious disease experts in Hong Kong had reminded us that 70% is not adequate for preventing Omicron at all. Now, they thought that it would be necessary to make it at 90%. So of course, 90% is not unachievable. Singapore and Melbourne, or I think Sydney, they had already vaccinated over 90%. But in Hong Kong, where people would honor the voluntary vaccination with choice, personal choice, there are many people who are still very stubborn and resist the vaccination. And so it's very difficult to surpass the 72% vaccination coverage, in fact. So unless the government would move to somewhat a more mandatory approach of vaccination. So that's why some of our experts had they had lobbied the government for something like a vaccine passport. Without the vaccine passport, people could not go into the places with people gathering together for dinners or entertainment, etc. So I think that would be a para-mandatory approach. I don't know whether it could work, but given now there is a national security law in Hong Kong, and people really would be more likely to have to abide or comply with the regulations and laws enacted in Hong Kong. So perhaps this might work, but I really don't know how long we need to take to get to the 90% mark. But of course, with finger crossed, we always said that, and we heard that South African colleagues have said that this disease is less serious. And UK had just got the report saying that this Omicron has only the severity 1/3 of the Delta. But real life, I don't know whether it is really like that. When so many people get sick with Omicron, still the hospital burden could be overwhelmed. I really don't know. So we still keep our finger crossed, because in Hong Kong, we don't have enough places for hospitalization and not enough places for quarantine. Even quarantine is, because Hong Kong really is a small place, and well, we have to keep our finger crossed, and perhaps the government really need to build instantaneously those quarantine places and the hospitals for this purpose mainly. So we have to learn a lot for the coming year. Although the 2 years have passed with this coronavirus and with high hope last year that we could really overcome this pandemic, but still, perhaps we are still in its trouble. But then thank you very much again, Sarab, and all the colleagues for the past year in organizing this Saturday meeting. And I am sorry that I often could not join timely or join with the full force that I wish I could, because on Saturday morning we have the usual clinic activities and hospital activities as usual, and so I'm still busy in taking care of patients. And today is the New Year Day, and I wish everybody a happy New Year, a healthy New Year, and everybody will overcome this pandemic as soon as possible. Thank you very much.
Thank you,
Dr.
Alvin.
Albin, Dr. Albin, just a question. Can you just tell us the secret, how China is managing this situation? Actually, they are having very less number of infections, given that they are having the biggest population in the world.
In fact, I think thank you, Jamal. And I really could not give the answer that you would expect because we are in Hong Kong here, not really getting all the information from mainland China. As you know, it's such a big country. Our mainland China had a lot of places, but I think there are weak points. So for the past few months, the weak points are the border with the the southwest border with with Thailand, with Myanmar, and Nepal, and people could have still got the commercial activities, and also people still move across the border to and fro because the people there are relatives. In fact, the same ethnic people, even of the same families, extended families, they are just living across the border. And so they still keep communicating, of course. And also the same thing is with the Mongolia. And the Inner Mongolia has a long border with the Mongolia. And then the Northeast has a lot of contacts with Russia and Korea. And so these are the points of the border that had the influx of imported cases. And of course, there are flights coming back to China with Chinese residents from other countries as well, although they had already blocked a lot of the flights coming back. But then still there could be. So Shanghai and Beijing, these are international cities still. Although they have blocked perhaps even over 90% of the flights, but still there could be. So that's why recently they have been quite anxious that there have been hundreds of cases each day. Of course, as you said, with the 1.4 billion of people, it seems that hundreds of new cases, it's really a very small number. But then to China, we are very cautious because this could spread very fast with the Omicron, with the community spread. So everybody is like still facing a battle and battling against the spread, local spread in the community. So I think the iron fist policy is working very well in China. That is, they had to have the mandatory restrictions, they could lock down the communities effectively, efficiently. In Hong Kong, we are following this approach in the small communities. Say, whenever we have one imported case, we definitely would have to quarantine them, isolate them in the facilities, in the hospitals, or in the hotels. And then we have the longest quarantine period in the world, 21 days, when they return from other places. But still, there are loopholes. Say, for example, in Hong Kong, we have exemptions for those aircrew members who come back to Hong Kong, especially for those cargo flights, because we need to have refill of our commodities, our daily needs. So these cargo flights, aircrew members are exempted from the strict restrictions of quarantine. And there they flouted the rules that allow them to have quarantine at home. And then they go out within 3 days, you understand, within the incubation period. Then although that when they are at the airport coming into town, they are negative. But because they are still in the incubation period, on the second day, on the third day, in fact, they have positive virus in their body. And then they go out to town, and there they had spread. And only after that, they had tested again, and then found themselves positive. But that's too late already, because they had already spread the virus in the community. So this thing could also happen in mainland China. So the flight, the cargo, the lorry drivers, those container trucks drivers, the truck drivers, the cargo airline air crew members, these are the loopholes members in the population that could have spread the disease. And also, I think for every country, there are the politeness for the consulate, for the VIPs in other countries coming to your country. They would be exempted. Every country is like that. But still, I think mainland China still have this loophole, I think. But then China, our government could have the effective lockdown of any community that had one imported case that had leaked into the population. So that's why I think still we could manage to have the zero tolerance approach in mainland China. And I hope I could answer your question partly.
Thank you so much.
So
thank you.
Thank you so much, Alvin. This was a very nice update. Very nicely explained. Can we have next week, can we have all the associations to come with a protocol we are following in each country on what COVID medication, what COVID testing has been done in what time period? Let's say if you've been tested positive, what is the first medication you guys do? What is the protocol you follow? What is the thing you advise your patients, and how it is working? Are they coming back to you guys? Is that an online thing which is happening, especially from South Africa, which they have started the leadership on it? Is it what we can do next week?
Very good idea. Very good idea.
So I think let's do this, and I will write in the group also, and I will send an email requesting all countries to share the protocol so that we can have a combined presentation or something. And let's go for it. Also, before we can end this meeting, I have few slides which I was just scrolling and I could figure it out, and I thought this would be nicer to show right now. So this is probably what has happened from September to December as a world data on SARS-CoV-2 sequence that are Omicron variant, and the data is from covariant.org. So this is something which we will close the meeting with, and this is how it looks like for the countries. So it's pretty obvious what's going on, and just wanted to share this thing. So wish you everyone a very, very happy new year, and we will close this meeting early today. And I request all the countries to come up with the COVID Omicron protocol for next week, and we can talk about it. Thank you.
Thank
Thank
you.
you, everyone.
Thank you very
Happy New
much.
Year. Bye.
Happy New Year.
Thank you
Happy
very
New Year,
much.
everybody. Okay, thank you.